270 cases of COVID-19 here in Greene County, and cases continue to rise around the region. Good evening once again to you. Thanks for joining us here at 10. I'm David Oliver. Heather is off tonight. A COVID-19 cluster is being investigated now in Marys and Phelps counties. Lawrence County is also reporting 4 new cases. And the Greene County Health Department says tonight a homeless person recently visited several local shelters after testing positive for COVID-19. Color 10's David Chasanov spoke with health officials at Mercy and Cox. David, how do they feel about where Springfield stands right now in terms of the virus and its progression?
Well, David, both hospitals say they're concerned, especially while seeing nearby counties getting hit hard.
Like Taney County, which has 43 confirmed cases of COVID-19. Its health department director, Lisa Marshall, talked about it on Facebook yesterday.
We are seeing our case numbers increase and our active cases are increasing. One of the things that we're also seeing is that we're having a large number of exposures.
Individuals were not wearing a mask in 2 of 3 recent public exposures.
We think face coverings are very, very important right now. We think they're so important that our board just passed a resolution to pronounce the importance of face coverings in indoor public spaces.
2 COVID-19 patients in Branson are being transferred to Cox Health in Springfield tonight.
We had 13 positives yesterday. So far today, we're at 16 positive cases. That's nearing a 9% prevalence rate, meaning 9% of those symptomatic patients that get tested ultimately test positive.
That's a big increase from where the hospital was a month ago.
That positivity rate was closer to 3%. 12 to 13% of patients that test positive ultimately need some sort of hospitalized care.
Hedgebeth says the data worries her.
When you see a number that is increasing that drastically in the last couple of days, it gives us some concern for what our hospital volume may look like.
At the moment, Cox Health has 8 COVID-19 patients, 2 of which are in critical condition.
I think there's a couple misconceptions, is that only elderly actually need hospitalized. 80% of our hospitalized patients are under the age of 61. Those that are younger can get sick enough to need hospitalized care.
Dr. Will Sistrunk with Mercy Hospital shares the same concern.
The younger population may become infected and take it home to their parents or their grandparents or to siblings or other family members or other members of our community that are at higher risk.
Mercy has also seen a jump in symptomatic positive cases this week.
I think that this is not surprising with the way the epidemic is unfolding across the nation. We all need to be more vigilant.
Sistrunk says if you have to travel this summer, do it in a smart way, meaning stay away from people as much as you can, wash your hands, and wear a mask. Reporting here in Springfield, David Chasnoff, Ozarks First.